Hey guys, this is FixerMed. Welcome back to my high-yield hematology and oncology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire system of hematology and oncology in a comprehensive but high-yield manner. This will be part 5 of my multi-part video series of doing so. Today, we will be taking a look at Polycythemia Vera. Without any further delay, let's go ahead and get started on today's content. All right, let's get started with a high-yield overview of Polycythemia Vera. Pathophysiology, Janus kinase 2, JAK2, mutation drives hematopoietic stem cell proliferation, leading to increased red blood cells, white blood cells, and platelets. Clinical presentation, elevated hemoglobin, which is usually greater than 18 grams per deciliter. Normal range is from 12 to 17.5 grams per deciliter. Increased white blood cells and/or platelets. Hyperviscosity syndrome, headache, blurry vision, fatigue. Pruritus, especially after showering due to basophilia. Suppressed erythropoietin levels. Management, acute hyperviscosity syndrome, phlebotomy, preventative chronic management, serial phlebotomy, hydroxyurea. Exam tips. Expect 2 out of 3 cell lines to be elevated with red blood cells always high. USMLE often asks for phlebotomy as the immediate treatment for hyperviscosity symptoms. Serial phlebotomy and hydroxyurea may be presented as long-term management options, but not together. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. Which of the following is the most appropriate initial management for a patient presenting with elevated hemoglobin, increased white blood cell count, and platelets, along with symptoms of hyperviscosity syndrome, including headache, blurry vision, and fatigue? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The clinical presentation, elevated hemoglobin, increased white blood cell count, and platelets along with symptoms of hyperviscosity syndrome suggests polycythemia vera, a myeloproliferative disorder characterized by increased red blood cells, white blood cells, and platelets due to Janus kinase 2, JAK2 mutation. Acute management of hyperviscosity symptoms involves rapid reduction of blood viscosity through phlebotomy. Serial phlebotomy is the immediate treatment to alleviate symptoms of hyperviscosity, aiming to reduce the elevated hematocrit. Hydroxyurea is a long-term management option to control cell proliferation and reduce the risk of thrombosis, but it is not the initial treatment for acute symptoms. Therefore, the correct answer is A, serial phlebotomy. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. B, hydroxyurea. While hydroxyurea is a long-term management option for polycythemia vera to reduce cell proliferation and prevent thrombosis, it is not the immediate treatment for acute symptoms of hyperviscosity syndrome. Phlebotomy is the initial management to rapidly reduce blood viscosity and alleviate symptoms. C, aspirin. Aspirin is not indicated as the initial management for hyperviscosity syndrome in polycythemia vera. It may be used in the long-term management to prevent thrombosis, but does not address the acute symptoms of hyperviscosity. D, allopurinol. Allopurinol is not indicated for the management of polycythemia vera or its associated hyperviscosity syndrome. It is used primarily in the treatment of gout to lower serum uric acid levels. E, erythropoietin administration. Erythropoietin administration is contraindicated in polycythemia vera, as it can exacerbate the already elevated red blood cell count. Erythropoietin levels are typically suppressed in polycythemia vera due to the negative feedback from elevated red blood cell mass. All right, guys, that is all I have for this video today. If you like this type of content, be sure to leave a like and subscribe for more content like this in the future. Be sure to leave any questions, comments, or concerns down in the comment section below. This is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying as always. Goodbye.